Good afternoon. My name is Volt. Student 110845, BSN 1. I wanted to talk about an acronym known as RACE. It's a test-taking strategy and a mindset. So a lot of people seem to know their stuff, but seem to have trouble applying it to exams. And this is probably a good way to approach it. It's RACE. Step 1, recognize keywords, meaning you look for keywords that really will affect what the answer is. Basically, that would be, which of these interventions should the nurse do next? Which patient should the nurse assess first? What should you do next? You'll have choices like, well, those are the keywords. What should the nurse do first? The patient needs further teaching if the patient understands proper instructions if, that kind of thing. 2, ask yourself what the question is asking. Basically, you have a bunch of gibberish on the fucking computer screen. You need to translate and figure out what the question is trying to ask you. 3, choose the one that makes sense. You're going to have stupid sounding answers out of those 4 choices. Okay, but you're going to have those ones that kind of make sense. Let's say a question is asking, what should the nurse do next? Let's say this guy has some kind of foreign object lodged in his trachea. Putting oxygen at 2 liters a minute sounds like it makes sense. It sounds like a perfectly good answer, right? What about making sure the airway is clear? That's a good answer too. So choose the ones that make sense. And then finally, eliminate incorrect answers. There's just going to be answers that sound fucking stupid. You want to eliminate those. Some of these are laughably dumb. Let's take a UTI question, for example. If there's a question that says, the nurse understands proper instructions if, when it comes to preventing UTIs, and one of the answers is wipe your ass from back to front, that is clearly the incorrect answer. So you can eliminate that shit, right? But yeah, RACE. Breathe it in, live it, breathe it, apply it. Volt out.